Welcome to our training program for aspiring healthcare support workers. Based on NHS and care certificate standards, this course provides the essential foundation for delivering compassionate, safe patient care. With over 60,000 healthcare support workers trained annually in the UK, this program represents the gold standard in preparation for this vital healthcare role. Our training equips you with the skills, knowledge, and confidence to excel in supporting patients across various healthcare settings. Our training program meticulously follows care certificate standards and competencies, ensuring you receive nationally recognized training that meets industry requirements. The curriculum has been designed to fulfill long-term workforce plan requirements, making you immediately employable upon completion. Whether you're new to healthcare or changing careers, this course provides the perfect entry point. We've structured the learning journey to build confidence progressively, starting with fundamentals before advancing to more complex aspects of patient care. Our training objectives focus on developing essential clinical skills, mastering the practical skills required for effective patient care, from vital signs monitoring to personal care support, ensuring you can confidently perform key clinical tasks. We also emphasize understanding healthcare responsibilities, including legal and ethical obligations, setting you up for immediate contribution in healthcare settings. Building patient interaction confidence is crucial, as you'll develop the skills needed for compassionate patient communication, learning to adapt your approach to diverse patient needs and circumstances. Lastly, meeting care. Certificate requirements ensures you meet the nationally recognized standards for employment in healthcare support roles. This comprehensive program welcomes individuals new to healthcare careers, as well as those changing from other professional backgrounds. It's particularly valuable for overseas-trained professionals who need to adapt to local practices and standards. Current support workers requiring formal certification and apprenticeship participants will also benefit from the structured approach that builds both confidence and competence in healthcare support roles. Understanding your role within the healthcare team is crucial. This includes recognizing the scope and limitations of your role, knowing when to escalate concerns and seek support from colleagues. Familiarization with key policies and procedures that govern healthcare practice ensures consistent and compliant care delivery. Competence awareness involves recognizing the importance of working within your competence limits and seeking additional training when needed. Personal development is about creating and maintaining a personal development plan to track progress and identify learning opportunities. Personal development is a continuous journey that requires honesty, self-awareness, and commitment. Through structured self-assessment, you'll learn to identify your personal strengths and areas for development. Development planning involves creating actionable plans with specific, measurable goals. Continuous improvement is about engaging in ongoing reflection and development. Accessing appropriate training materials and support is essential for professional growth. Duty of care involves understanding the legal framework that defines your responsibility to provide safe, competent care to patients. This includes awareness of negligence, consent requirements, and the duty to report concerns. Dilemma management involves developing skills to navigate complex ethical situations whilst maintaining professional standards. Escalation protocols are about mastering the procedures for reporting concerns, knowing when to seek additional support, and understanding the chain of responsibility within healthcare settings. Supporting choice involves facilitating decision-making whilst promoting independence and dignity. Balancing risk management with respect for patient preferences. Equality and diversity are fundamental in healthcare, ensuring care delivery respects individual dignity and rights. Understanding human rights in healthcare contexts is crucial, as is comprehending the 9 characteristics protected under the Equality Act 2010 and their implications for care. Person-centered approaches involve implementing care strategies that acknowledge individual differences and preferences. Cultural competence involves developing awareness and skills to provide appropriate care to people from diverse cultural backgrounds. Person-centered care places the individual at the heart of every decision and interaction. This approach requires genuine empathy and the ability to see beyond medical conditions to the whole person. By building therapeutic relationships based on trust and respect, you'll support patients to maintain their identity and independence. Understanding individual needs involves recognizing unique preferences and requirements. Promoting dignity and respect means maintaining personhood in all interactions. Supporting informed choice involves facilitating decision-making. Adapting to changing needs requires responding flexibly to evolving circumstances. Effective communication forms the foundation of excellent healthcare. You'll learn to adapt your communication style to individual needs, whether working with patients who have sensory impairments, cognitive difficulties, or language barriers. Mastering both verbal and nonverbal techniques ensures you can establish rapport and trust. Record keeping and documentation are equally crucial, ensuring accurate information sharing within healthcare teams. You'll also understand the importance of electronic communication systems as essential for integrated care delivery. Maintaining strict information privacy and appropriate sharing practices is in line with legal requirements and organizational policies. Supporting individuals during intimate care activities with sensitivity and respect is paramount. Cultural awareness involves respecting diverse cultural practices and preferences regarding modesty, same-gender care providers, and privacy expectations. Physical boundaries involve using curtains, screens appropriately, and respecting the individual's environment, particularly in their own homes. Proper nutrition and hydration are fundamental to patient recovery and well-being. You'll learn to support individuals with eating and drinking, including techniques for those with swallowing difficulties or reduced appetite. Recognizing early signs of malnutrition or dehydration is crucial for timely intervention. The training covers food safety practices and managing special dietary requirements, whether due to medical conditions, religious beliefs, or personal preferences. You'll develop skills in monitoring and recording nutritional intake to support comprehensive care planning. Understanding when and how to access specialist mental health resources is vital, avoiding stigmatizing terminology. Recognition involves identifying signs and symptoms of mental health concerns, from mild anxiety to severe conditions requiring specialist intervention. Support involves providing appropriate emotional support and creating safe environments for individuals experiencing mental health difficulties. Communication involves using appropriate language and listening techniques to support individuals in distress. Referral involves understanding when and how to access specialist mental health resources, avoiding stigmatizing terminology. Safeguarding adults involves learning to identify adults at risk of abuse or neglect, understanding factors that increase vulnerability such as isolation, dependency, or cognitive impairment. Reporting procedures involve mastering the protocols for reporting safeguarding concerns, including documentation requirements and the importance of timely action. Protective measures involve understanding how to implement protective strategies whilst respecting individual autonomy and choice in line with Mental Capacity Act principles. Safeguarding children involves understanding the types of abuse, including physical abuse and non-accidental injury, emotional abuse and its subtle indicators, sexual abuse recognition and response, and neglect in various forms and contexts. Reporting responsibilities involve immediate action requirements, documentation of observations, confidentiality considerations, and following organizational procedures. Multi-agency working involves understanding professional roles, information sharing protocols, attendance at case conferences, and contributing to protection plans. Basic life support involves recognizing emergency situations by assessing responsiveness, by checking for normal breathing while looking for chest movement, listening for breath sounds, and feeling for breath on your cheek. Activating emergency response involves calling for help immediately or direct someone to call emergency services 999. Request an AED if available in the vicinity. Begin chest compressions by placing hands in center of chest and compress at least 5 cm deep at a rate of 100 to 120 compressions per minute. Provide rescue breaths after 30 compressions. Give 2 rescue breaths if trained and willing. Tilt head back, lift chin, pinch nose, and create a seal around mouth. Each breath should take 1 second and make the chest rise. Health and safety is fundamental to protecting both patients and staff in healthcare environments. You'll learn comprehensive risk assessment techniques to identify and mitigate potential hazards before they cause harm. The training covers essential fire safety procedures, evacuation protocols, and the correct use of firefighting equipment. Safe moving and handling techniques are emphasized to prevent injury to both staff and patients, alongside proper accident reporting to support continuous improvement in safety practices. Handling information involves understanding GDPR principles and their application in healthcare settings, including lawful bases for processing sensitive data. Confidentiality involves maintaining appropriate confidentiality whilst recognizing situations where information sharing is necessary for patient safety or legal compliance. Cybersecurity involves protecting electronic patient information through appropriate password management, screen locking, and awareness of phishing attempts. Record keeping involves creating accurate, timely, and comprehensive healthcare records that meet professional and legal standards for documentation. Infection prevention and control involves understanding proper hand-washing technique using WHO 7-step method. PPE usage involves correct selection and application of personal protective equipment. Waste management involves appropriate segregation and disposal of clinical waste. Infection control involves standard precautions and transmission-based practices. Clinical skills development involves accurately measuring and recording temperature, pulse, respiration, blood pressure, and oxygen saturation. Understanding normal ranges and recognizing significant deviations requiring evaluation. Specimen collection involves proper techniques for collecting urine, stool, sputum, and other specimens, following correct labeling and transportation procedures to ensure sample integrity. Wound care involves basic wound assessment, cleaning techniques, and dressing application. Recognizing signs of infection or delayed healing requiring specialist intervention. Personal care involves supporting patients with hygiene needs whilst maintaining dignity. Adapting approaches for different levels of independence and mobility challenges. Person-centered care begins with a holistic assessment that considers physical, emotional, social, and spiritual dimensions of well-being. Rather than focusing solely on tasks, this approach prioritizes understanding the individual's personal history, preferences, and goals. You'll learn practical techniques for supporting activities of daily living whilst promoting independence and self-care. This includes adapting approaches to individual circumstances, whether working with someone recovering from surgery, living with a long-term condition, or requiring end-of-life care. Developing skills to fully concentrate, understand, respond, and remember what patients are saying is crucial. Using techniques like paraphrasing and summarizing to demonstrate understanding is key. Mastering the art of questions that encourage detailed responses rather than yes-no answers is essential. Learning how to elicit important information without leading or influencing the patient is a valuable skill. Building confidence in addressing sensitive topics with empathy and professionalism is vital, especially in difficult conversations. Recognizing the different forms of dementia, including Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia, is crucial. Each type affects different parts of the brain and presents with varying symptoms, from memory loss to personality changes, visual hallucinations, or language difficulties. Developing specialized approaches to support meaningful interaction with people living with dementia is essential. This includes using simple, clear language, maintaining eye contact, minimizing distractions, and allowing extra time for processing. Understanding the holistic approach to managing pain and symptoms while supporting psychological, social, and spiritual needs is crucial. Recognizing that palliative care can begin well before end of life and run alongside other treatments is important. Supporting individuals to express and document their wishes regarding treatment options, preferred place of care, and after-death arrangements is vital. Understanding the legal framework for advanced decisions and lasting powers of attorney is also essential. Providing skills to support families through anticipatory grief, providing practical and emotional support, and facilitating meaningful time with their loved one is a key component. Tailoring support to individual needs and strengths is essential in learning disability support. Understanding behavior as communication is a key aspect of positive behavioral support. Promoting skill development and autonomy is crucial for independence. Supporting communication through accessible formats and communication aids is vital. Ensuring healthcare access and medication management is also an important part of supporting individuals with learning disabilities. Mental health awareness is essential for all healthcare support workers, regardless of their specialization. You'll learn about common mental health conditions, including depression, anxiety, psychosis, and personality disorders, understanding their presentations and impact on daily functioning. The training covers supporting recovery through strengths-based approaches that focus on wellness rather than illness. You'll develop de-escalation techniques for supporting individuals in psychological distress, alongside strategies for promoting positive mental health through meaningful activity, social connection, and stress management. Nutrition and hydration support requires a comprehensive approach that begins with accurate assessment of individual needs. You'll learn to monitor food and fluid intake using standardized charts, recognizing patterns that might indicate underlying problems requiring intervention. Identifying nutritional risk factors such as poor appetite, swallowing difficulties, physical limitations, and cognitive impairment is crucial. Implementing support strategies like texture modification, adaptive equipment, and prompting is essential for maintaining adequate nutrition and hydration. Conducting thorough evaluations before attempting any movement, considering the person's weight, mobility level, cognitive status, and environmental factors is essential. Identifying hazards and determining appropriate equipment needs is crucial. Choosing appropriate aids such as sliding sheets, transfer boards, hoists, and slings based on individual assessment is important. Ensuring equipment is properly maintained and staff are trained in its use is vital. Applying biomechanical principles to minimize physical strain, including proper body positioning, wide base of support, and using leg muscles rather than back muscles for power is key. Accurate observation and monitoring are fundamental skills for healthcare support workers. You'll learn proper techniques for measuring and recording vital signs, including temperature, pulse, respiration, blood pressure, and oxygen saturation. The training covers the use of early warning score systems to identify deterioration in patients, alongside the crucial skill of recognizing significant changes requiring immediate escalation. Documentation standards are emphasized to ensure clear communication between healthcare team members and continuity of patient care. Understanding the limitations of the healthcare support worker role regarding medication administration is crucial. Recognizing the distinction between assisting with medication and administering medication is important. Learning proper procedures for medication storage, including temperature control, security measures, and stock rotation to prevent administration of expired medications is essential. Reporting any adverse effects, adverse reactions, or compliance issues requiring escalation to registered practitioners is a key responsibility.